Midline swellings of neck. Some of the important midline swellings of neck include dermoid cyst, thyroglossal duct cyst, lymphadenopathy, laryngocele, Ludwig's angina, subhyoid bursitis, sternal tumor, and cold abscess. Dermoid cyst generally develops in the line of embryonic fusion. So, this cyst may appear anywhere in the midline of the body, as also in places where the two embryonic processes meet each other. For example, just below the tongue in the midline, that is, sublingual dermoid, etc. Most midline cervical swellings in children are caused by thyroglossal duct cysts. The cyst normally presents as an incidentally noticed, asymptomatic soft mass. A small number will present as an abscess or intermittently draining sinus because of spontaneous rupture due to infection. Lymphadenopathy. Cervical lymphadenopathy is common in childhood, particularly in the lateral neck, but less so near the midline. The submental lymph nodes drain the lower lip, floor of mouth, and apex of the tongue and can cause midline swellings just behind the mandible anteriorly. Thus, a tender swelling in the submental region demands careful inspection of the lip, floor of mouth, gums, and tongue for evidence of infection. Ectopic thyroid tissue. Abnormal thyroid descent can result in thyroid tissue located in an ectopic position. Ectopic thyroid is more common in females. Patients with ectopic thyroid are commonly hypothyroid, and an elevated thyroid stimulating hormone may cause enlargement of the tissue during childhood, bringing it to clinical attention. The most common abnormality by far is lingual thyroid, which most series report as accounting for 90% of cases, but tissue may present in the cervical midline and other locations. In the majority of patients with lingual thyroid, it represents the only functioning thyroid tissue, and a normal thyroid gland is not palpable in the neck. Movement. Movement of the tongue will cause minor movement of all midline neck lesion. The relationship of the thyroglossal cyst to the hyoid bone means its movement in swallowing is pronounced both with tongue protrusion and swallowing. Movement of the cyst is better palpated rather than observed. If the cyst is held between the fingers during swallowing, the strong tug on it from movement of the hyoid bone can be felt. Unlike thyroglossal cysts, dermoid cysts do not move significantly with tongue protrusion, as they do not attach to the deeper structures. This feature is useful in distinguishing the two conditions. Transillumination. Transillumination can help distinguish a large uninfected thyroglossal cyst from other lesions. The viscous content of a thyroglossal cyst will usually glow brilliantly, while the sebaceous material in a dermoid cyst and the solid nature of other lesions prevent transmission of light. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.